But imagine, imagine if I'm giving local anesthetic. We're going to pretend this is a patient's femoral artery. If I'm giving anesthetic, that's the other reason why we don't like slip tips. They don't stay on. These are good tools.
Careful.
All right, there you go.
Danger. Okay. All right, so if I'm going to give local anesthesia, I'm going to go bevel up, a little bit of an angle. I'm going to numb the skin, right? If I were to press on this really, really hard, this slip tip could actually come dislodged. And I don't want to demonstrate it, but it could, you know, if I'm doing it forcefully, it's going to spray.
No wonder it's called
Okay.
slip tip, got it.
Right. So it's not a problem if there's just lidocaine or flush or whatever in here, but if I've got blood in this syringe, it could splash in my eyes, it could splash in the
So you're just using
circulator's
that-
eyes. So the idea is that we don't really like slip tips for that purpose, so we don't use them for lidocaine. I'm pretty sure none of the doctors like them. I'm going to do set an example here. None of the doctors like the slip tip syringes. They do have a use, we'll talk about that later, but for giving lidocaine, always want to use a Loralox syringe. Okay, there's some doctors that hate these so much they can't even see them on their tray or they'll get upset. So 2 syringes for lidocaine for femoral approach, or 2, not syringes, 2 needles. Then for the entry needles, remember these are the 18 gauge, both of these. They've got a bevel on them, okay? You guys can see the bevel. For the one with wings, if you hold the bevel this way, then this is how it's gonna, you don't wanna do it this way, right? So the little wings kind of indicate how you would hold that needle, okay? Some of the doctors like these, some of them like the ones without the wings. They both do the same thing. So we would insert it into the artery, bevel up, 30 to 45 degree angle. Okay. How do we know we're in the artery if we're using this needle? Flashback is one. So if we're in the artery, you're going to have a little bit of blood flashing back. The other thing too is if we're close to the artery, it's going to make the needle move. So we can actually see the artery kind of pulses and causes the needle to move. So that's kind of how we know we're close. So these are entry needles. Be careful with these. Keep them covered. They're very sharp. I probably don't need to pass them around, but if you want to look at them. Does anybody want to look at the bevel? Oh, that's not going to work, is it?
Ooh.
Never recap needles. You guys can pass those around if you want. All right, scalpels. These have a safety mechanism on them. Okay, so one-handed is the idea with these scalpels. When you guys are setting up trays, you never need to uncover a scalpel, so don't do that. But just so you know, when you get to be scrubbing in the Cath Lab, these were made to close them with one hand so that you're not going to stick anybody with it. This is for the nick in the skin, so basically this is what we're doing, just like that. And that's all there is. Tiny little nick in the skin. We'd cover it, and then we'd take our hemostats, find the hole, and then spread them, and that's all the subcutaneous tunnel is. Very simple, okay? This is a micropuncture needle. So we would use this for radial procedures. Notice how it's smaller, and it's also shorter, because trying to get in the radial artery is much easier. There's not as much tissue, fat, all that kind of stuff. It's pretty easy to get in the radial artery. So that's a 21 gauge. With these micropuncture kits, the cool thing is they come with their own little wire. So this is different from your standard guide wire, right? It's a lot smaller and thinner. It's really just made to put in the sheath. Hopefully this will go. There it goes. Okay, so once we're in the artery with this micropuncture needle, we'll take the needle off, and then the sheath introducer set will go in. You'll notice too with these micropuncture wires, this shaft is really stiff. And it's just designed that way because since it's a really thin wire, we don't want floppy up here because we need to be able to have some stability to put a sheath in, okay? So that's your micropuncture stuff. I'll just pass the wire around so you can look at that. Some of them come with a dilator in case you need to dilate up, but we don't really use that often. So let me just show you this process. So we give local, right?